found out about this project from a family member who is part of the Co-Production Carers and Cancer Project. In 2022, my mum was diagnosed with a very rare skin cancer and several other complex health conditions. Alongside other family members, I became one of her unpaid carers while working full-time as a mental health nurse. When she reached end-of-life care, I took 3 months away from work to spend precious time with her, visiting daily in the hospice and later in the care home during the final weeks of her life. I got involved in the Cancer Carers Project so that nobody goes through the journey and trauma that my mum, myself as a carer, and other family carers went through at this time. Over the course of my mum's illness, we accessed multiple services across Lincolnshire and London with very mixed experiences. In Lincolnshire, repeated GP appointments, district nursing input, dermatology advice, and accident and emergency attendances were largely unhelpful, with concerns about a worsening leg lesion repeatedly dismissed, poor communication, and expectation that I would undertake clinical tasks because of my professional background, and care that often failed to preserve mum's dignity or involve her directly, despite her having capacity. In contrast, a GP in London listened to our concerns and made an urgent referral to the Cancer Centre at St Thomas's Hospital, where coordinated investigations and rapid access to diagnostics led to the diagnosis of a rare and aggressive skin cancer that may have benefited from earlier detection. Following surgery and radiotherapy in London, we continued to care for Mum at home before her condition deteriorated. The care of the elderly consultants at Pilgrim Hospital were compassionate, respectful and person-centred, while the St Barnabas Hospice at Home team were brilliant. Most staff at Butterfly Hospice were good, although there appeared to be confusion around palliative and end-of-life care, and some cruel comments were made by a member of staff. Mum ultimately received end-of-life care in a care home, where she sadly died a short time later. I felt there was a lack of information and support from all services we accessed. There needs to be both general information and more tailored support for the individuals and their carer following a diagnosis. One of the main barriers I faced was that, because of my medical background, I was treated as a healthcare professional rather than as a carer or a daughter. Instead of being supported in those roles, I was expected to take on responsibilities that took away from the quality and precious time I had with my mum following her diagnosis and during her palliative and end-of-life care. I believe my mum needed an earlier diagnosis and for our concerns to have been listened to rather than dismissed. If that had happened, her chances would have been better. She would have been physically better for longer, and more treatment options may have been available to her. This experience has changed me as a person, and I no longer have faith in hospitals or the systems around them. Care needs to improve, be clear and concise, and be tailored to the individual. Professionals need to listen, look beyond the diagnosis, and truly hear what people and their carers are saying. Carers often have to fight to have concerns heard, and it should not be that stressful. They should be able to focus on being present with their loved ones and making the most of the precious time they have left together. Carers also need permission from others and from themselves to not be okay. They need support, time out, and should not be left to manage conversations and interactions that healthcare staff should be handling. Sensitive, respectful, and dignified care matters, especially in a person's final days and hours. While some pockets of care and individual staff were excellent, more support is needed for carers and relatives, including information about grief, its physical and emotional impact, and clear signposting to bereavement support after a loved one has died. Information should be offered in a choice of formats, including written information, leaflets, and verbal discussions. It needs to be accessible to everyone, including people with learning disabilities, limited IT skills, or limited access to technology. Support information and key contacts should be offered as a choice from the point of diagnosis and remain available throughout treatment, allowing people to access information in the format that works best for them. It should be up to the individual when would be best for them to receive this kind of information. This should be received as standard info not too late after diagnosis, and there needs to be follow-up information provided depending on individual circumstances. Following this experience, I feel like I do not want to use NHS hospitals, especially in Lincolnshire. I feel that treatment for mum was based on who you knew in the systems. Thank you for listening to my story. For more information, go to HW Links or Health Watch Lincolnshire. You may even want to share your own story.